COVID-19 brought renewed fears to tobacco smokers. According to the World Health Organization, smokers were likely to develop severe diseases with COVID-19 compared to non-smokers, triggering a mass reaction to quit tobacco. That motivation explains this year's theme, Commit to Quit.
This day is supposed to actually help us to remind people who are struggling with tobacco to quit. During this COVID pandemic, evidence showed that smokers are more likely to develop severe disease of COVID-19 compared to non-smokers. And I think explanation is very, very clear. If you look at those pictures, if you look at those lungs, and if you get COVID in there, already you have the issue of efficiency of the lung function, and then you get fibrosis secondary to COVID, or even before you get to fibrosis, you can actually easily die. During the lockdown, there were reports that smokers experienced higher levels of stress as they could not easily find where to buy their tobacco, yet some used it as a means of coping with the stress. On the other hand, the same reports also showed that during the lockdown, many people liked to quit but lacked access to information, support, and treatment that could help them quit.
The World Health Organization introduced legislation targeting consumption that is incorporated in other countries like Uganda.
As a country, as you have earlier been informed, enacted a comprehensive law. And this law is a tobacco control law that was enacted in 2015. And it is now fully operational after having overcome the hurdles of legal battles, as you heard. And this law is prohibiting people from smoking in public. The law bans shisha, it bans flavored tobacco, smokeless tobacco, and the sale of single sticks. Furthermore, the law requires that a cigarette pack should have the warning pictures to show the effects of cigarette on one's health. This one is supposed to provide information to the smoker so that it acts as a consent that, yes, I know the problem, but I have decided to burn my lungs.
Uganda has made strides in lessening the burden. The 2015 Tobacco Act puts a ban on advertising, sale, and promotion. Dr. Byama Mutamba, a senior consultant in charge of alcohol and drug unit at the National Mental Referral Hospital Butabika, details on the risks.
Annually, 8 million people worldwide, globally, die from tobacco-related health problems. Use of tobacco and other addictive substances starts at a young age for various reasons. So yes, we find a lot of them in school. And it is important that, like we said, tobacco affects people health-wise, socially, economically, and in many forms.
Almost 1 in every 10 Ugandans use tobacco products daily, according to 2016 Tobacco-Induced Diseases Report. Lucky Atuhaire Iwinjira, SBL.